So if a cycle of in vitro fertilization does not result in a pregnancy, there are a lot of different reasons why that may be. And the reason as to why that may be helps us answer the question, well, how many more times should you try it? The initial cycle gives us a lot of information, and that information can vary greatly. For example, if the reason why a pregnancy didn't result is because the woman is incapable of producing normal eggs and therefore not capable of producing normal embryos, then you probably don't repeat it. If there's a low response and a compromise whereby the patient produces a small number of eggs and embryos, or perhaps the embryos don't grow well, there are things that we like to try to adjust, both in terms of medications as well as the environment in which the embryo may grow. So then we think that the cycle ought to be repeated with some adjustments made. If a patient does not conceive because the embryos are mostly abnormal genetically, then it is possible that repeating a cycle would be a good thing to try to see if that compromise in the genetic content of the embryos is a relative compromise or an absolute compromise. So there are numerous reasons why cycles fail, and each reason is associated with a different answer of how many cycles should you try. But this shouldn't go on forever. It should be with an end in sight. And the next step, if the patient is assessed to be not potentially fertile, depends widely upon the individual, may include third-party reproduction, such as ovum donation, which works very well for people with poor ovarian responses, or perhaps gestational surrogacy, which works very well for women with abnormal uteruses. So everybody's different, and the answer to the question of how many cycles do you do varies. So I think we have to treat that as an individual issue.